Okay, everybody keeps asking me what an implant is. So what I want to do is I want to actually make a little crazy video on what an implant pretty much is, okay? So everybody's hung a picture on the wall, everybody's used a Molly bolt before, I'm hoping you have, but this is pretty much what a dental implant is. The first thing is a piece of sheetrock, hang a picture on the wall. So what I'm going to do is make a little hole in here so we can start. So you would actually drill into the bone, kind of like, a little bit like what I'm doing here. Okay. Once that's done, then this becomes your dental implant. So you want to hang the picture on the wall, you're going to put the Molly bolt right in. So it goes in, and this is pretty much what a dental implant is. It gets screwed into the bone, just like I'm screwing this thing in right now. It's flush with the bone. We have different type of implants. Some are tissue level, and some are, this is a bone level one. It gets flush with there. That's your implant. Then you have to wait 3 months, it heals. After it heals in 3 months, then we do is we then get either a custom abutment or we make a tooth that goes right over the top and we take an impression. So you could take your tooth like so, and you could take your set screw like this. It screws right into the implant. That's what we're going to do right now. And it's just like hanging a picture on a wall. So screw this right into here, like so. We'll make it easier because some of our tools even sound like this, as people have had implants. And we get this as flush as possible. It's going right through. And, okay. So this would be considered pretty much a tie-based crown. So the screw goes in, or it's a prosthetic screw that then holds the crown on top of the implant. In other words, we just put a Molly bolt, which is in the bone, with the screw, which is the part of the tie base that's here, holding this crown on top of it, or holding the picture on there. Then what we do is, so you don't see the crown, is once that's in and the bite's good, we then go along and put some composite over the top, a little Teflon there, some composite, and we make the screw disappear so no one sees it in the mouth. Just like I'm putting a little bit of white out on top, and it all matches up. That's one type. The other one is people ask, what is a custom abutment? Well, that's where things change. So custom abutment, same thing. We're going to go along and place an implant. So let's start by placing our implant. Again, make a little hole here. Okay, there we go. So you drill the hole to the bone. Again, we place the implant right like so. And the implant's going right in just like this. So a custom abutment is, there's an aesthetic area, mainly in the front. These screw retain crowns, a lot are done from the in the posterior because you don't really see the screw. It's not a problem. You can do them if the implant's placed a little bit more toward the palate on the uppers, so that you won't see the screw. You can't have a screw sticking out from from your front tooth because now it's going to look terrible. So when you have an issue where there's an angle and there's an angulation, you can't do it correctly, you make what's called a custom abutment. This, in a sense, we take an impression, the lab sends you something different. So here's my custom abutment. So this goes in here, and as we go along and we screw this down, we would then bring this to where it needs to be, and then cement our crown over the top. So in this case, our crown is going to be the picture that I have here, my little award. This is where it would go meet up right to your other crown, and you wouldn't see it whatsoever. So in an area where you would see on the top here, it's now, you don't see anything whatsoever. And that's where it hides the screw, hides the implant, and it looks more aesthetic. So, little things on implants. Hope it helps.